Good morning. Today is Saturday, July 10th, 2021. This is our regular Saturday morning Facebook Live class, and this is also part of our today's program, a yoga teachers training from National Yoga Academy, Virginia Beach, Virginia. So these students, the 200 hours yoga teachers training classes, they're going to have a whole day session on introduction to yoga therapy. So we already have discussed with the students what is yoga therapy, but for all the bigger audience, which we describe every time, but let me go over with you again, that yoga, which the original Sanskrit word is called yog, anglicized version is called yoga, so that's what we use in West as yoga. It's a philosophy called Yoga Sutra Patanjali, 196 aphorisms, of which 193 is to quiet down your mind. It's a practice called 8 limbs practice, called Patanjali Ashtanga Yoga. 8 limbs are you all memorized. That first is there. Yam, social restraint; niyam, personal restraint; asanas, your alignment, both external, internal alignment; pranayama, pranayama. Prana is the life force, yama is a controlled restraint. It is a voluntary, regulated breathing. Pratyahara, pratyahara means reject, ahara means your intake. That means you're controlling your 5 senses, all the information you receive through our 5 senses. Dharan is the focus, 6th, 7th is your dhyan, which is a meditation, and 8 is a samadhi, which is union of your body, mind, and spirit. Every yoga therapy practice is a relaxation response, activation of parasympathetic tone, and it creates a body's physiological changes, which corrects all of our underlying chronic medical condition. Yoga therapy primarily is adaptation of the practices based on the client's or the patient's clinical condition. That means learning how to use the same tools, same yoga philosophy, same yoga practices, learning how to use them based on the patient's clinical condition. And the reason being, if you are a yoga practitioner, today, anybody coming to your class will be coming for an underlying medical condition. Now, you are here, somebody came to you, and you are going to guide them. First of all, this person may not even ever heard what yoga is, and you are going to introduce them a step-by-step for a yoga therapy. And remember one thing, I get this here all the time. I cannot do this asana, I cannot do this pose, I cannot do this pranayama. No, you don't master the poses, you don't master the pranayama, you don't master the meditation, but you practice it in stages for its therapeutic benefit. I cannot do a headstand. I don't want to do a headstand. It's fine, but keep your head down. Keep your head down and feel what happens. Put your head down, you'll be miserable. You can talk, you cannot breathe, your face is all flushed, is all red. Your pressure inside the brain is high up, pressure inside the eye goes high up, pressure inside the neck goes high up. Just back off a little bit. a shot of pain, completely effortless breathing. Stay in that posture for a while. 1 week, 2 weeks, 1 day, 2 days, 1 month, 1 year, doesn't matter how long it takes for individual person, you will see you feel comfortable in that posture. Bring your head down a little bit more. Because what is happening, your relaxation response is setting in. And the brain is getting a signal, what is called neuroplasticity, habit forming. It will let you, I'm sitting in my cross-legged, I'm not sitting, my brain is allowing me to sit. Cannot sit down in the cross-legged, sit in a chair. Sit in a chair. What are the basic requirements for yoga therapy? To practice. First requirement is able to sit down with your spine straight. No question about it. You sit down anywhere, any place, keep your spine straight. Next question comes, why? The moment you keep your spine straight, remember my skeleton, if you leave my skeleton, is going to fall in front. All the muscles on the side of skeleton, these are called paraspinal muscles. These muscles contract to keep me straight. So when you feel it, there is a look like a piece of two bricks sitting here. But if I keep my spine straight voluntarily all the time, these muscles cannot contract it too long. Muscle is going to relax slowly and slowly. When the relaxation takes place, before the muscle relaxes, it causes a little bit of a twitching. Then it completely stabilizes. It's called beginning of an asana. Then it's called a stability. Then it's called a profound relaxation. When the profound relaxation takes place, you feel there is a two pillows, soft pillows sitting here, and you practice it as a lifestyle. Yoga therapy is also a daily routine, the lifestyle. You do it all the time. You sit down like this when you're eating, sit down like this when you're driving a car. Sanskrit is called Merudanda Achal. Spine is straight. Then it's called mind. The mind has to quiet down. How the mind quiets down? Mind in yoga is a content of your five senses. What I see, what I hear, what I smell, what I taste, what I touch. All the five senses when the contents are put together, that keeps me awake, alert, and active. If I learn how to shut down my senses, my mind quiets down. Most important sense is my vision. Eyes is a direct extension of my brain. I learn how to close my eyes. I have patients. I'm a physician, I'm a physician. My patient said, I cannot close my eyes. I close my eyes, I feel almost restless. Slowly and slowly we learn to close your eyes. Use your hand gestures called mudras. Mudras are called hand gesture. Mudras connects your body and mind. Why hand? Half of our brain controls our hand. If you look at our brain, it's called a homunculus, like a short human being. 1/4 of our brain controls my head and neck. From this part to here, 1/4 of my brain. Half of my brain is my hand. 1/4 of my brain controls the rest of my body. Hand quiets down my mind. Then comes your breath. Breath, lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to keep it open. You have 4.5 liters which you can exchange. So learn how to breathe out first. Take a deep breath in slowly, then breathe out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. So you learn those things in stages, how to do the breathing. You have to practice your breathing. We'll go through all the different breathing. In fact, we'll do the whole pranayama practice this afternoon with our students. We'll do pranayama and a meditation. And this morning, we'll primarily practicing asana practice. When you do the pranayama practice as a therapeutic yoga, it will be totally, we call it effortless ease. Effortless ease means you are able to talk. You are able to sing. You are able to do this as if it's your normal breathing cycle. Same with asanas. If you feel any pain, you back off. But if you can be comfortable, sit down. So we'll teach you slowly. Let's come back, and then we'll start relaxation of your hands, your wrist, your elbows, your shoulder, your neck, upper part, and how to create a relaxation response. For me, sitting down for a while, so what I do, I go back, change my feet, and sit down in an opposite direction now. What happens here, that my opposite side of the brain is now active. And you will notice your one side feels easier than the other side. Now, you cannot sit down on the ground. Let's see what we'll do. Suppose you want to sit in a chair. You'll sit in a chair. Just a simple chair. So what you will do in a chair, when you sit down in a chair, suppose you sit down in the front of a chair, but you keep your spine straight. Your body will be like a 90-degree angle, here, here, here. If you cannot touch the feet, you can put something underneath the feet. And most of the thing I like to put is a folded blanket. What is a folded blanket? So you can, when your neuroplasticity sets in, you can remove part of the blanket. Then if you go all the way to the back of your chair, then you keep your spine straight. That's the way I use my computer. My computer screen is here. My keyboard is here. I'm doing it. I'm not hunchbacked. The moment you're hunchbacked, you are creating the tightness, creating all the diseases. This is the way you'll be driving your car. This is your 24/7 yoga practice. People say, how long you do yoga? You do yoga 24/7. I'm always doing yoga. So, spine straight. When you stand up, you'll see. When you're getting stand up, you will be standing up as if your ear, your shoulder, everything has to. We'll show it to you. We'll show it to you. But look at what I do. I've been doing it for a long, long time, all my life. I use a special chair. These are called kneeling chair. I don't know if you've ever seen it or not, but I have it. This is probably my third or fourth one. I always use this kneeling chair. I have a bunch of them. This is the one, little fancier one. I have a lot of lighter one. I show it all the time. So I will sit down in front of my computer, in front of my desk. What it is, you put your knees here, you're kneeling it down, your spine is always straight. You cannot bend your spine to sit in this chair. So from here, you'll be doing all the work throughout the whole day. Next thing, I get a question all the time, where do you get this kneeling chair? These days, obviously you know where to get them. It's called Amazon.com. Go to the Amazon.com, type a kneeling chair. You will have hundreds of kneeling chair will come up. And I have many of them. Now, how to elicit a relaxation response? If you can sit down in the ground or if you're in a chair, doesn't matter. The poses I'm going to do, you'll be able to do it in a chair also. I'm very comfortable sitting in the ground, so let me show you sitting in the ground. Take your both the feet, put underneath the knees, keep your spine straight. First component. Second component is your hand gesture, mudras. Touch your tip of your index finger and thumb. This is called a meditation mudra, dhyana mudra, or a jnana mudra, and put gently over your both the knees. Close your eyes. Remember the five senses. Most powerful sense is your vision. Remember, you are going in stages with a person who has never done yoga, never heard of yoga, came to you for a therapeutic practice. Close your eyes, bring your awareness to your breath. In all the yoga practices, you breathe out first. If you're practicing with me, please practice with me and you'll see the difference. Breathe out first, effortlessly. Take a deep breath in effortlessly. Breathe out longer than breathe in, completely effortlessly. Wonderful practice. Now, let's do this practice because this looks a simple practice, but it is a powerful practice to create relaxation response. You can do breathe out first, count of 2 in, 1 and 2 in, count of 4 out, 1 and 2 and a 3 and a 4 out. Then you progress a little bit, count of 3 in, count of 6 out, count of 4 in, count of 8 out. And whenever you feel a little bit of an effort, you stop, but you come short of it and keep practicing. Then you notice any pain. If you have any pain when you're sitting down, if you feel a pain here, you back off. Find a spot where you are feeling little bit of we call it a comfortable discomfort and stay in the posture. If you say it's hurting me, I'm not going to do it, you will never progress. What will happen if you do this relaxation with your eyes closed breathing, this thing is going to happen slowly. When this thing happens, then you switch your feet and see if you can sit down with the opposite feet crossing. What it does, it activates both sides of your brain. And you will see all the asanas we're doing, we'll be doing it equally on both sides. Now, let's do this breathing practice. Sit down, hand mudras, eyes closed. Let's do it count of 2 in, count of 4 out, count of 3 in, count of 6 out. You continue. We do it so long, we can do easily count of 8 in, count of 16 out, count of 10 in, count of 20 out, but do it on your own pace. And remember, yoga therapy is not competitive. It is your self-healing, art of self-healing, art of learning how to monitor your individual excuse me we do a jalneti. We wash our nose every morning, and during our practice we do get some drainage back from our nose, but it's entirely normal, and this is a part of our practice session. You should do it. This is called your daily routine, dinocharya. Eyes closed, spine straight, hands touching index finger and thumb. Breathe out first. Count of 2 in, count of 4 out. You continue, but let me continue a little bit more. Let me do it count of 4 in, count of 8 out. Breathe out first. Count of 4 in. Count of 8 out. Very easy for me. I can do it count of 8 in, count of 16 out. Let me show it to you. How easy. But remember, I'm talking, I'm singing, I'm totally effortless. Count of 8 in. Count of 16 out. Wonderful practice. I feel a sense of relaxation. When a sense of relaxation, I progress. How do I progress? Take the one foot. If you're doing it with me, see if you can do it. Take your one heel to the back, put your one foot in the top, your knees drops down. This is called a Siddhasana, perfect pose. Now, if your knee is not dropping down, don't push it down. If it is up here, let it be here. If you push it down, what will happen? Come back higher. Close your eyes. Have your hand mudras. Continue breathing. This thing is going to happen. As simple as it is. Then if you're incorporated relaxation, like sitting in a chair, you do it with me, you'll be relaxing your hand. So if you look at a baby, babies are always relaxed. And we learn the whole yoga from the baby. If you look at a baby, baby will get up in a downward facing dog. Baby will get up in a cobra pose. Baby will be sleeping with a called, sleeping close angle pose called Supta Baddha Konasana. The way the baby sleeps, if you have insomnia, we tell you to sleep like this. Baby will close the hand. It's called a baby fist. How the baby closes the fist? Puts a thumb inside and close. This is a baby fist. Try it. If you do it, your hands will be relaxed. See, when my hands are relaxed, see, my fingers are all separated. My hands are relaxed. Initially, it was very tight. It doesn't go through. Now it goes through very easily. Now my hands turn around. You can do all this stuff. So you can put your hand in the front. You can do it with breathing. Breathe out first. Take a deep breath in. Breathe out and close your hand like a baby fist. This is also called a yogic fist. Breathe in, breathe out. Then do with your eyes closed. Eyes closed, breathe in, breathe out. When you do eyes closed, you pay enough attention to your breath. Wrist gets relaxed like this. You can do both hand and wrist together, like wrist here. When you bring it down with a yogic fist. Breathe in, breathe out. Breathe in, breathe out. Do with your eyes closed, you will have a profound sense of relaxation. Even when you can relax your hands, you will see the relaxation extends the rest of your body. That's called a holistic practice. That means yoga, it covers your whole body and mind. Our Western medical practice, we call it a reductionist. It affects only one side. Subcarpal tunnel. In Western medical practice, you'll be working on your wrist because you have a carpal tunnel in the wrist. In yoga, I'll say your posture, you are a hunchback that causing your carpal tunnel. Correct your posture, you'll see carpal tunnel will go away. Comfortable like this. Now I do the opposite side. Now it is my other foot here. My other foot comes up, drops down. As easy as it is. Elbow gets relaxed with it's called the inward rotation. It's called the pronation. Elbow gets tightened up with this called a supination. It's called pronation. It's called supination. So, say tennis elbow. Tennis elbow is when you take the ball and try to hit with the bat, you have a external rotation, which causes a pain. So it'll be internal rotation. Internal rotation, a powerful tool you can do is called a prayer pose to the back. If I do a prayer pose to the back, which I'll do it very soon, you will see my hand will have a inside rotation called the internal rotation that relaxes your elbow. Shoulder joint is a ball and socket joint. So you can put your hand in the shoulder, slowly bring your elbows together. If you cannot bring it close, wherever it comes, if it comes here, don't cause a pain. If there's a pain, you back off. From here, you breathe out first, take a deep breath in, slowly rotate your shoulder. Breathe in, breathe out. This looks like a so simple practice, but it has a profound therapeutic outcome. How do we know? Because we monitor our physiological changes. Do it opposite. Breathe in to the opposite side. Have your eyes closed. Pay attention to your breath. No pain. Effortless breathing. See, I'm talking. I'm singing. I'm breathing. That is my practices. I'll be talking when I'm doing my shoulder stand, headstand, my peacock pose, you name it. I'll be talking. So now I'm comfortable here. What I do, I go a little bit more. This is called your half lotus. So I'll be eventually getting into a lotus pose, sitting down, but I'm going in stages. So now I have pain. I feel pain here. So what I do, I back off. Find a place where I don't have any pain, but it's not comfortable. I have a little bit of a discomfort. Very important. Pain here, back off. Somewhere you find. The moment you say, I have a pain, I'm not going to do it, you will never progress. And most important thing is that if you do not take a pain medication and do a asana practice or yoga practice, because the moment you take a pain medication, this is your normal body's response telling you that you are creating an imbalance in your body. Don't do that. Do not take a pain medication and practice yoga. Now you're not relaxed enough. So you use another tool. Remember, the five senses keeps us awake, alert, active, and tight. Shut down your five senses, then our brain has a vibration. Brain is in a state of vibration, which we can record it. We call it electroencephalogram, EEG. In fact, our whole body cells are vibrating. We create another vibration, which is called a sound of a bumblebee, and it's called a bumblebee breathing. The two frequency interacts, it's a pure physics, two frequency interacts, cancels. It's called a harmonic resonance. Cancels the frequency, and the brain quiets down. How do you know it? See, in our day-to-day practice, we do with this, our health tracker. This is my Apple Watch. I can record my EKGs. I can see my heart rate. I can see all my body parameters here, physiological changes. So we are talking from a science-based practice. If I'm doing the Bhramri Pranayam, the bumblebee breathing, we have done a EEGs, we have done a polysomnogram with a functional MRI, we see the brain does not respond to external stimulus. When you're doing a Bhramri Pranayam and you put a sound like this, brain doesn't get active. If you put a flashlight, the brain doesn't get any active. And the same thing as the Om. If you get Om sound of Om, and in fact, all the spiritual sounds, you see, they all ends with the Ma. Shalom, Amen, Om. All of them, these total spiritual practices, quieting down your mind. Then it's called palming and cupping. You palm and a cup, and that also activates your parasympathetic response because it's a branch of your vagus nerve. Vagus nerve activates your parasympathetic response. So let's do a couple of bumblebee breathing. And if you're doing it with me, you can do it. And I'm sitting here. See, this is a yoga therapy. You're using your asanas, posture, using your pranayamas, using your mudras, using your breathing, using your meditative postures. Put your both the index finger on your forehead. Use your three fingers to close your eyes. In fact, you could do another mudra. It's called a Shanmukhi mudra. Use your thumb to close your ear and close your mouth. You will do all the breathing through your nose. In yoga, you do not breathe through your mouth. God gave a mouth only to eat and talk. Breathe out through your nose. You will take a deep breath through your nose and will breathe out with the sound of a bumblebee. So breathe out first. Deep breath in. Breathe out with the sound of a bumblebee. Wonderful. When you keep on doing it, almost feel like you are not even connected in the body. Pumping and cupping. Take both the hands, keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses. Take both the hands like a cup. Put it over your eyes like a cup. Let the eyes take all the heat from your hand. Then massage your forehead. Massage your eyes, massage your face. Then massage the ear, behind the ear, front of the ear, in fact, inside the ear. This is called, and the earlobe is called the auricular branch of the vagus nerve. There's a branch of the vagus nerve which comes, and all the vagus nerve activation is called afferent. That means signal goes to the brain and the signal comes out as a relaxation response. Always, ear is very important. And remember, this is called auricular branch of the vagus nerve. Now slowly bring your hands and massage in front of your neck on both sides. Here is an organ called a carotid sinus. Carotid sinus, when you massage, also activates a parasympathetic activation. The nerve supply is through the called glossopharyngeal nerve. It's called a cranial nerve, but the afferent, the information going to the brain, goes through vagus nerve. Take your hands, massage in the back. Is the insertion of two muscles. One is called a trapezius, another called sternomastoid muscle. Both the muscles are supplied by your cranial nerves. Remember, we have the nerves coming from our brain and the nerves coming out from our spinal cord. Nerves coming out from the brain is called a cranial nerve, and you will see our eyes are supplied by the four cranial nerves. Very, very relaxing practice. We are all trying to relax our body and mind. So I'm very relaxed now, so I go to the opposite side now. So go to the opposite side is called half lotus, Ardha Padmasana, or called your swastikasana. The tightest part of your body is your neck. Relax your neck. Four postures, you go to the back and the front, side to side, look at the back and then rotate your neck slowly, but do all with the breathing that also you do with your bumblebee breathing, Brahmari Pranayama. And I'll show it to you just now. But before that, relaxing the whole upper part of the body is called prayer pose to the back. And let me show you how to do a prayer pose to the back. So I'm going to turn around. You will take a look at it and you will practice with me if you can. It's a wonderful practice. What you do, slowly take your hands in the back, wherever it is. If it is here, stay here. If you can bring it close to your hands, it's perfect. If you can slowly put your hands in a prayer pose, it's great. Stay here. Remember, when you can keep it here and do your breathing out longer than breathing in. Do it between 5 to 10 breaths. Do it with your eyes closed. The hands will go high up a little bit because relaxation is setting in. And in stages in time, you'll see it will keep creeping up slowly and slowly. It will go up a little bit more. But you stay here. I teach this thing to the IT people who are in front of the computer, who are hunchback all the time. And all the IT people has a high incidence of lifestyle related disorders. They get a diabetes at the age of 35, 40, hypertension, heart disease. I mean, it's amazing. High cholesterol. It's almost like an epidemic with the information technology people, IT people. But see, I'm comfortable. I'm talking. I'm even singing. So when you were working in the computer, take your hands, put a prayer pose to the back, and stay in this posture. So come back where I started again, where I was. I had the right foot on the top, as a half lotus, Ardha Padmasana. I have my hands to the back, all the way high up in a prayer pose to the back. Now I'll be relaxing my neck. So my whole lower part of the body, upper part of the body, whole head and neck will be all completely relaxed. So I breathe out first, take a deep breath in, slowly drop my neck to the back. And when I'm breathing out, I breathe out with the sound of a bumblebee, like this. You have no idea what kind of physiological change are happening. When you put your neck in the front, you try not to bend your neck so much. So when you bring the chin towards your chest, it is called your chin lock, Jalandhar Bandha. Chin lock stimulates your carotid sinuses. It's a profound relaxation response. See, my hand is started going high up again. My mouth is full of saliva. And that's the state you want to be to get a yoga therapy. One more time. But when you're putting your head down, be sure there is no pain. And always remember your breath is effortless. What it is, in yogic tradition says, a food shit to the breath shit. Means if you do any imbalance in your physical body, it will show up in your breath, which you don't want. The moment you have a little bit of effort in breathing or catching the breath, you stop. So let's do one more time. Breathe out first. Take a deep breath in and slowly put your head to the back. Breathe out with the sound of bumblebee and put it in front. If you can do without any effort. Do side to side. Breathe out first. Take a deep breath in. With your eyes closed, you'll see will be relaxed a lot more. Breathe out first. Deep breath in. Look all the way to the back without turning your shoulder. See, my eyes are closed. My whole awareness is on my breath. Breathe out first. Take a deep breath in. Rotate your neck to the back, left to the back to the right, right to the back to the left. Drop your head down, breathe out first, take a deep breath in. What a wonderful practice. My hands are still in the back. I'm in a profound level of relaxation. What happens, the muscles of respiration, which are in your chest area and the back, they're also called skeletal muscles. They also get relaxed. They're also trainable. What a trainable means, like this muscle called pectoralis major, pectoralis minor, in the back of latissimus dorsi, these are all skeletal muscles. They can be trained, like here. If biceps, and I have these weights here, I can do a 5 pounds. After a few weeks, I can do 8 pounds. Then I do 10 pounds. I do 15 pounds. It's normal. Do both hands, equally. So these muscles will get trained. So you can do count of 3 in, count of 6 out, count of 4 in, count of 8 out, count of 10 in, count of 20 out. Then when you relax, your breath gets so effortless that you'll be sitting down next to me and breathing. I will never even hear you are breathing. And these are the ads, breathing ads you will see in television all the time. Yes, there is a medication called what, the Fassendra or something. Oh, this is the sound of a breath when you have asthma or when your breath is not effortless. And this is the sound of your breath. They're close to a deer. They're looking at a deer when you are taking this medication. So you don't need a medication. Yoga will do it for you. So now I'm relaxed. What I do, take the other foot in the top, sit down. This is a lotus pose. Oh, it is so difficult. Nothing is difficult because you have not got in one time. You did it in stages, you use everything. It is a profound relaxation response. So to show it to you how profound it is, you feel a sense of lightness. Put your hands on both sides, push it down, your whole body goes up and stays high up, called Tolasana. And you can stay up as long as you want. Go higher up more and more. Just to demonstrate. Another powerful asana is called Yoga Mudra. Keep your spine straight and look straight. Put your hands in the back and slowly drop your head down and listen to your body's signal. What a body signal? Pain. If you feel a pain here, you back off. Find a spot where you little have a discomfort and stay. If you stay here, do your breathing out longer than breathing in. Between 5 to 10 breaths, with a few weeks, it will come down here. There will be no more pain. And with a regular practice, you will see your head will all come down. Slowly and slowly, it will touch the ground. And you'll be comfortable staying here. How long you stay? Initially between 5 to 10 breaths. Then you can stay a little longer and longer. Another relaxation practice, your eyes. Remember in your posture, both the feet has to be adequately grounded. That is called balancing poses. You have to learn how to balance your both the feet. And we'll do it, and I'll show it to you when I stand up. And activate both sides of your brain. Like when you're walking, put your right foot first, then the left, right, left. Getting up in a steps, right first, then the left, right, left, right, left. Don't get one foot. I see people going high up, right, 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 right. No, alternate. Get down, same way. Right one first, then the left one. Right one, left one. Or left one, then the right one. Balance it. So if you think our body is like a car, these feet are like your wheels, like tires. But they have a steering wheel. Your steering wheel is your eyes. You need to learn how to relax and balance your eyes. Why? Eyes are supplied by 4 cranial nerves. In fact, eyes is a direct extension of your brain, and eyes is your mind. In yoga says that the mudras, hand gestures. Whenever you have a hand gesture, because hand is supplied by half of your brain, hand, eyes goes there. Jatha hasta tatha drishti. Means wherever your hand, that's where your eyes goes. Jatha drishti tatha mana. Whenever your eyes goes to your mind, is your brain. Jatha mana tatha bhava. That means whatever is your mind, it goes to your emotion. The emotions are the site, your soul is in the heart. Yatha bhava tatha rasha. Rasha is your 9 emotions. So when you learn how to control your emotions, that's a part of the brain called a limbic system. The 2 nuclei called amygdala and hippocampus. Amygdala responds to fear, hippocampus responds to memory. It sends a signal to our body's homeostasis called your hypothalamus. Hypothalamus sends a signal to your autonomic nervous system. It balances between your sympathetic and parasympathetic nervous system. It also signals to your pituitary gland, the master endocrine gland, so-called a pituitary adrenal axis, pituitary through the adrenal gland. It creates a hormonal homeostasis. That means all the hormonal changes get balanced. Medical term is called a psychoneuroendocrinology. Wonderful practice. So in the eyes, what you do, primarily, you do an eyes practice that you focus in your eyes. So what you will do, you'll be looking at a finger, or we do with call it jyoti tratak, like you light up a flame. Generally with your oil lamp or a candle, look at the flame, exactly level of your eyes, and then keep looking without blinking. Because blinking is both voluntary and involuntary, and relaxation response basically is voluntary control over involuntary function. Slowly and slowly, you can even bring it close to you. And when you bring close to you, many a time what you can do, somebody else can look at your eyes, or even you can take a selfie to see the position of your pupil. If both the side of the brain is balanced, when you bring your finger close to your nose and you look at your finger with both the pupils should be equal distance from your finger. If they are not equidistant, you have an imbalance between the side of the brain. And how to balance? You do the rotation of your eyes. Put your hands on both sides. Then, without turning your neck, look to the right, left, look to the right. Look to the left, look to the right. Look left, right. Turn your hands high up. Look right high up, left down. right up, left down, right up, left down. Turn it other way around. You do left up, right down, left up, right down, left up, right down. Then look high up, then down, up and down, up and down. Then you do look high up, left, bottom, right, 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 up, right, bottom, left, up, right, bottom, left, up, right, bottom, left, up, right, bottom, left. Wonderful practice. Eyes movement, balancing. Eyes are supplied by four cranial nerves. We used to remember in medical school called SO4, LR6, superior oblique. There's a muscle supplied by the fourth cranial nerve. Alone, one nerve supplies one muscle in the eye. LR6, lateral rectus, supplied by sixth cranial nerve. Doesn't supply any other muscles. Only one muscle's in the eye. Optic nerve, second cranial nerve, supplies the main retina to see our vision. And the trigeminal nerve is the fifth nerve which supplies all around your eyes. So you're relaxing your eyes, upper part of the body, even lower part of the body, all this, or you can do another way, lower part of the body. So lower part of the body, you put your feet straight high up and sit down. This is called your Dandasana, stuff pose. Hands on both sides, spine straight. Then for the toes, separate your toes. Breathe in, breathe out, bend your toes down. Breathe in, breathe out. Close your eyes, breathe in, breathe out. The moment you can separate your toes, the toes gets relaxed. Remember, feet, ankle joint is carrying all the weights for you. Always practice with your breath. So breathe in, breathe out. Breathe in, breathe out. I do all the time, every single day I practice with my eyes closed. And with this practice, I don't know if I told you before, I had an open heart surgery about 20 years back. I'm completely, almost like a disease-free, medication-free. I'm enjoying a good quality life. Breathe in, rotate your, breathe in, breathe out. Do it opposite side. Breathe in, opposite side. A profound level of relaxation. Remember, when the body is relaxed, blood vessel get relaxed. Your blood vessel in the heart, called coronary arteries, gets relaxed. The lining inside the blood vessel, called endothelium, the plaque, hardening of the arteries, that also slowly and slowly goes away. Blockage in the artery starts to open up. Remember, we all talk about hip joint and knee joint. Hip joint and knee joint is carrying all the weight, but all the weight is carrying in the ankle. You relax your ankle, give a profound level of relaxation. Seated forward bend. Take your hands, see wherever it goes. It's okay. If it goes all the way down, if you can hold your toes, it's great. When your body gets a little bit of relaxed, you look straight, keep your spine, and keep coming down. Don't bend your knees. So it will come in stages. People always ask me, I can bend my knees, I can bring my head down. No. If you want to do that, it's fine. But what you want to do, keep your knees straight, use the power of your breath and power of a relaxation for the body to come down. And the body will go into coming down slowly and slowly. You come to a point, you will see, for me, I can even clasp my hand. And head is coming down, but I'm still talking.
I'm still breathing. All the way down, my head is touching my knee. And I stay here. Stay here between 5 to 10 breaths. Paschim Uttanasana, seated forward bend.
When your toes are separated, your pressure transmission takes place. It's a wonderful practice. When you put your feet down, you'll see your toes are all separated. In fact, the market is full of it. Yoga toes, yoga socks, yoga shoes, but that all are geared to separate your toes separate. You have sandals. I have all of them. You know, people give me the gift, or we have the yoga toes. But for us, I take one foot on the top, take my hand, I put my fingers in between my toes. Initially, it was very difficult, but slowly and slowly I can do it. Take my knee, slowly bring it up. Here's my baby. Breathe out first. Take a deep breath in. Slowly let the baby go down, and then he goes all the way to the ground. If it doesn't go down to the ground, if it is here, I let it be here. Continue my breathing, continue my relaxation, and this thing will happen. Remember, if I push it down, it's going to come back again. This thing will do on its own. Knee is the site of fear. Hip is the site of emotion. Stress is nothing but a fear of unknown. Knee is relaxed, your stress is under control. When emotion, what is emotion? Hypertension, high blood pressure is an emotion-related disorder. Go to see your teenager's room, your blood pressure goes high up. Talk to your boss, your blood pressure goes high up. Emotion is related to your all neuropsychiatric disorders. Balance it, do both sides. Bring your other feet high up. The left hand, separate your toes. I do it all the time. In fact, I do this, then I do my pranayama practice. Like if I do a bastrika, like a bellows, I'll sit down, put my hands here, I'll put my knees here, I'll do. I just did simple 100 of them. I can do 400, 500, 600, completely effortless. Again, I bring my baby high up. See, I'm talking, I'm breathing. All the breathing I did is my normal breathing. So people ask me, how fast, how slow, how long? Number is only one. Effortless ease and listening to your body's signal. As if it's a normal breath, initially to 30 seconds is good. You still can do 30 seconds today. You'll be able to do 3 minutes very soon. It's a wonderful practice. Breathe in, breathe out. Hip joint relaxation. Baddha Konasana. Put your feet together. Bring it slowly here. Hands here. And butterfly. Slowly you can do. There is no rush. Spine straight, eyes closed. Your knee joints will come down slowly and slowly. Always pay attention to your breath. Always keep your eyes closed and always bring your awareness to your breath or visual imagery. Visual means you can focus your mind. So we'll be showing you a few more practices for the balancing, but one of the most important balancing practice is able to sit down with your one knee in the top of the other one. And remember, if you cannot sit down, it's okay, but try where you can. This is called your buffalo pose, Vaisasana, like a buffalo or a cow. They'll sit down like this. This is the beginning. Then you do what is called your cow face, Gomukhasana. And I'll show you how to do equally on both sides and what is the effect of it in your body and mind, and what is the relaxation you can sit in. Remember, these are called powerful therapeutic asanas because it's relaxing your whole lower part and upper part of the body. When you're able to relax, you can put other foot in the top. Or you can do another asana. It's called Ardha Matsyendrayana asana, spinal twist. Let me show it to you how to do it. Then you will know what the breath does to your bodies, okay? So, okay. So we can do both the asanas together, or, okay, you can do this, or you can do, see, if you can put your one knee on the top first, I'll show it to you. I'll turn around and show, but in this I'm showing in the front. Put your one foot here, right knee. Left hand goes outside your right knee, right hand goes to the back, left hand slowly turn around, comes, touches your left knee, then the left ankle, then your left foot. Close your eyes, breathe out first, take a deep breath in, and slowly turn your body to the right. You'll see at a certain point, your breath catches. When your breath catches, you back off. Stay here. Breathing out longer than breathing in, about 5 to 10 breaths. When you do it equally on both sides, both the side of your brain will get balanced. So you're not going to do all this in one day, but you are doing it in stages. See, I'm sitting here. When I started, I sit down here. I may sit down for weeks and weeks. Yoga therapy is a powerful medication, but it's a very slow medication. Meditation is medication. We'll teach you the pranayama and meditation this afternoon. So now I feel a little bit of relax. I push my left knee out, get my right hand outside my left knee, left hand goes to the back, comes down to your knee, and slowly comes down to get into your ankle. Breathe in and out, slowly turn your body to the left. There's a very lost in translation, funny translation of this pose called Lord of the Fish pose, Ardha Matsyendrayana asana, but it's the name of a yoga master on which this asana's name was derived. So look at other therapeutic asana, is a wonderful therapeutic asana, is your, say, cow face, Gomukhasana. See how effective and balanced both sides of your brain. My right knee is in the top of my left knee. My right hand goes high up. My left hand is here. I put my left hand in the middle, in the center. Right hand will come down. It will touch it, hook it. Essentially, I'll be handshaking each other. But I'm so relaxed. I'm staying in a relaxed pose. I'm comfortable, I'm talking, I'm breathing. Go back to the opposite side. Now my left knee is in the top of my right knee. See, I sit down a little bit, I breathe, I get into a state of relaxation. Left hand goes high up, right hand comes here. I put the right hand in the middle. Left hand will come down, it will touch it, hook it. Essentially, I'll be handshaking each other. If you're doing it with me, you'll see your one side is easier than the other side because you're all in a state of imbalance between right and left side of the body. When you can do it equally on both sides, you're in a profound level of a balance. And in yoga it says, health is defined as a balance of your body, mind, and spirit. Another wonderful practice is able to sit down, what yogis calls it a squatting pose or a malasana. You can sit down in a squatting pose. In a squatting pose, you see your ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed. Then you put your hands together, separate your fingers. This is the way hand gets relaxed. Extend your wrist gets relaxed. Put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Close your eyes, keep your spine straight. You breathe out, then breathe out longer than breathing in and keep doing it with a profound level of relaxation. No disease will dare to come to you. Next sign of health, able to get up from sitting without any support. From here, you will get up without a support. When you will be able to get up without a support, and then what you will do, you'll be able to get down and get up without a support, and that is going to do your health. See, I'm sitting down here in a squatting pose, and I'm getting up without a support. Then when I create a balance, see, normally my feet is in the shoulder distance. I'm comfortable. Going against the grain of your habit is your balance. This yogic principle called the law of opposite. We get always attracted to the attributes we have. So learn if you can put both the feet together. When you put both the feet together, you start in creating a balance in your body and mind. Then look at your posture, your ear, your shoulder, your hips, your knees, and the ankle should be in the same line. Called your dandasana, like a stick. Body is like a stick. Okay, get your hands high up. It will look like you are in a totally straight, and that's the way you walk. When you see somebody 90 years, 100 years young, you don't see any hunchback living 90, 100. You know, spine straight. So look at this wonderful practice. Now you can cross your feet, creating a balance. Cross your feet. Crossing your feet, if you can sit down and get up without a support. Practice it. Initially, it will be almost impossible, but when you'll be able to do it, we call it a money back guarantee. Money back guarantee, your all chronic diseases will slowly going to disappear. Cross it opposite side. Sit down, crossing your feet in the opposite side, and can get up opposite side. When you become more relaxed, when your health gets better and better, what you will be able to do it, initially it will be almost impossible, you will be able to do it, you will be able to go all the way down into the ground. Sit down in the ground. Have your feet crossed. Close your eyes. Do something, a deep breath in and breathe out without effort. And when you relax enough from here, you can get up without a support. Try this. Go all the way down, see if you can get up without a support. If you use one hand, you lose 25% of your health. If you use two hands, you lose 50% of your health. So, sit down again. Opposite side. Cross your feet in the opposite side. Sit down. Again, bring the relaxation, bring the awareness in your body and mind. Try to shut down everything around you. I cannot do it because you have too many inputs coming to you. From here, you don't have any inputs, you get up without support. When you get up, then you practice your balancing poses. Foot together. If you fall down, you always fall down with your hand, open hand. It is called, if you fall down, you get a fracture in your wrist. It's called a Colles fracture. Take your hands out. Put a prayer pose to the back. Hands in a prayer pose to the back. If you're doing it with me, say try. If you can stand on your left foot. I'm a right-footed, right-handed, so if I can stand on my left foot. Initially, almost impossible, but if you try initially, you might be touching something. You may hold something and then try. Or you can put in a chair, touch in a chair. But when you get used to it, you can do it. 10 seconds, 20 seconds, 40 seconds. When you get a little proficient in it, close your eyes if you can do it. If you can do it with your eyes closed, initially it is almost impossible, but it is we said, money back guarantee for your health. I practice every single day in the morning. These are my routine. I don't teach. I share my practice and my knowledge with all of you. You can do so many asanas. You can do asanas sitting down, laying down, face up. We have so many asanas. But relaxation comes in with your balancing both sides of the brain. That's what therapeutic yoga is. We'll show you this afternoon that how to sleep, how to do the complete relaxation of your body and mind. Able to stand on the one foot, right foot. 10 seconds, 20 seconds, 40 seconds, and close your eyes. If you see if you can stand closing your eyes, it's a wonderful practice. Let me show you another practice, which you'll be very pleased if you can do it. We don't do any breathing pranayama practice standing up because pranayama causes an altered sense of consciousness. But pranayama is done in a very relaxed state. If in a relaxed state, so you can do called Kapalbhati pranayama, breath of fire. This is, I'm not doing the pranayama practice, I'm just showing that I'm properly relaxed. So I can do a tree pose standing up, one foot here, can take another foot here, can do tree pose, and in a tree pose, I can do my Kapalbhati pranayama. Keep on doing it. Keep on doing it, and you will see the wonderful. Balance it on the other side. Always a balancing practice. Another thing, when you do a tree pose with a hand in the back, is always different than putting a hand in the front. When you do a hand in the front and do a tree pose, and putting a hand in the back in the tree pose is entirely different. So, when you're putting the hands in the back, and also when you tree pose, the precaution, you generally try to put it below your knee, try to put your foot above the knee. Try not to put in the knee because knee stabilizes it. Another powerful yoga practice is for relaxation is to put a head below your heart. When you can put a head below your heart, a lot of physiological changes takes place. When it's head below your heart, initially, the pressure inside the brain goes high up, pressure inside the eyes goes high up, pressure inside your called carotid arteries goes high up. You feel miserable, cannot even breathe, cannot even talk. But if you keep your head down slowly and slowly, the neuroplasticity sets in. It's called a baroreceptor sensitivity. That blood pressure, the baroreceptor goes, and we can see it. We can see it all here with our physiological monitor. You know, Apple's Tim Cook said the next Apple Watch is going to be a health monitor. So let me show you what we're doing. This is called widespread head touching the ground, called Prasharita Uttanasana. So I'm spreading my legs slowly and I'm supported. My hand is supported, my knee. Remember, I'm the supported forward bend. Very important. When you do forward bend, when you do unsupported forward bend, create a lot of tightness here. Supported forward bend. Wherever you can come down. You come down a little more, is good. For us, slowly and slowly come down, separate your feet as far as it is. You can sit here. And you can go all the way down, put your head down on the ground. Touch your right hand. On this posture, you'll be able to do a Kapalbhati pranayama because you're relaxed. It's a wonderful massaging of a pelvic floor. If you do it, you'll feel the massage of a pelvic floor. For the men with a prostate problem, to massage your prostate gland. For the women, it will massage your pelvic floor. It's incredible practice, and when you do it, you can feel it. We have all the other standing poses, we can do it. That's okay. But this is, you create relaxation. Lay down, the face down on your ground, on your mat. You do the back bend on the mat. Back bend, you do your cobra pose, Bhujangasana, you do a locust salavasana, you do a bow pose, Dhanurasana, but you hold into the pose. Don't get it in and out. Even if you do a cat pose, if you do a camel pose, stay in the pose. Stay in the pose between 5 to 10 breaths. Okay. Let me go ahead and sort of finish with you the most relaxation, that a relaxation you would be able to achieve. The how to achieve a relaxation, and then you will see any asana will come to you. You don't have to ask for. You'll be able to sit down very easily. It's called your Vajrasana. Sit down here, sitting down, very nice, spine straight. It's the most relaxing asana. When you're relaxing, okay, let me show you what the relaxation will do. To give you steps for like a headstand. I said, I want to do a headstand. Oh, I don't want to do it. I have a hypertension. I have a heart disease. My doctor asked me not to do it. I have a neck problem. Don't do it. Who asked you to do it? But if you're able to do it, it's such a relaxation response. See, pain, neck pain, back pain, everything. It's not your herniated disc, it's not your spinal stenosis. It's irritation of a nerve. It's a contraction of a muscles. All the pain will go away. All the chronic pain is due to tightness. Relaxation response takes away pain. For the seniors, the loss of balance, all the seniors will fall down and they'll die. When you do the balancing poses, your balance comes back. This is your stance. Put your stance here, clasp your head, put your head down. You feel miserable. Cannot talk, cannot breathe, your face is flushed. Come back out slowly. Come back here. Put your head down. Still were miserable. Put your hand down, put your head like on a hand. Still miserable, put it here. Do somewhere, somehow, at certain point, but the moment you stay here for a few days, few weeks, you'll be able to do it here. 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 When your breath is normal, see, I'm taking a deep breath in, breathe out. I don't have any flush. I don't have anything. I just keep my body high up, keep walking. I keep walking, my body will go high up, but I don't do anything. I don't let anybody touch me. I don't let anybody help me. I'll keep my high up, and you'll see my whole body will go high up on its own. I do it every single day. Absolutely have no issue out of it. People do a Savasana, corpse pose for relax. But before corpse pose, you see, most relaxing is your sleep. Corpse pose is not the sleep. So you will see who sleeps well. So baby, if you see a baby, and if you see a baby sleeping, you'll see babies breathing out longer than breathing in. Baby also does some of the breath holding. It's called kumbhaka. And then you sleep like a yogi. Let's finish our practice with a relaxation sleeping and see how you'll be doing it. So you'll be going down to your mat. So go all the way down. Hands are on both sides. In a normal savasana, you separate your feet until the width of your mat. Keep your hands facing up to the sky. About 6 inches from your side, and be sure your head, see if your head doesn't go down, if you want to put something under your head, please put it under your head. Don't do this. Put your chin way high up. If you put your chin way high up, we call it sympathetic. Try to put your chin down. You will see your breathing normalizes. Your abdominal cavity will come down, and a baby will do a abdominal breathing. Abdominal breathing is relaxing. Abdominal breathing is when you breathe in, you'll see your abdomen walls. When you breathe in, it will go high up. Breathe out, it will come down. Breathe in, breathe out. Then you need to see how the baby sleeps. Have you ever seen how the baby sleeps? Baby will take both the feet, and baby will put both the feet together and put the knees down like this. This is called Supta Baddha Konasana. Laying down, closed angle pose. If you have an issue, you can put two pillows underneath or folded blanket. This is a very nice called restorative poses. Incorporate your breath. The way I do my breath, I will do here, breathe out first. I will breathe in, say, count of 5 in, count of 10 out. Or say I'll do count of 4 in, count of 8 out. I'll do about 5 to 10 times. Let me show you a couple of times, see how to do it. Hands are on the side. I'll breathe out first. I'll breathe in with a count of 4 in. Breathe out with a count of 8 out. Again, I'll breathe with a count of 4 in. Breathe out with a count of 8 out. After doing a few times, between 5 to 10 times, now I'm incorporating my breath holding. I will do count of 4 in, count of 16 hold, count of 8 out. Generally what I do, then I start increasing, then I'll do count of 5 in, count of 20 hold, count of 10 out, count of 6 in, count of 24 hold, count of 12 out. Let's do count of 4 in, 16 hold, and 8 out. It's a 1:4:2 ratio. I'm all doing abdominal breathing. Breathing out first. Breathe in with a count of 4 in. Hold your breath with a count of 16. Breathe out with a count of 8 out. Do it again one more time. Breathe out first. Breathe in with a count of 4 in. Breathe. Hold your breath at the count of 16. Breathe out with a count of 8 out. Then slowly, initially, you go into your fetal position and turn onto your right side. And the reason is when you're turning into right side, your left nostril opens up. Your left nostril is a cooling breathing. It's called moon energy, Chandravedi pranayam. When you're sleeping first, your body core temperature is still high. So a cooling balances. Remember, yoga is a balance. And I will do it on the other side, you will see. But here, we put our head on your folded hand. We are in a fetal position, and that is where the yogis sleep. Initially, after a while, when the sleep cycle starts in, sleep has two cycles called REM, rapid eye movement, and they call non-REM. Non-REM is the deep sleep. It has the stages, stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 is very early, but stage 3 and 4 is a deep sleep. And that's a deep sleep you need. Then when you become a little bit more sleepier, then you sleep the whole night, you sleep on the left side. You've been on the left side, yogis don't have any pillow, they take the head, hands, they put it like this, and they sleep like this. I've been sleeping like this for a long, long time. And it suddenly, then sometimes I put a pillow and I put my head like this in a pillow. But I prefer doing, initially your hands might get numb, you might feel uncomfortable. But once you do it, it's a wonderful practice. What it also does, we have the main venous channel. The blood comes in a vein, it's called the inferior vena cava. Main channel, the blood comes and goes into your heart, so it does not get obstructed. So when somebody pregnant, like prenatal yoga or internatal yoga, they always stay in the left side. They will do even your savasana on the left side because you don't want the uterus to compress on the vena cava to block your return. So that's the way you get a proper venous return, and with the relaxation, your heart function improves. It's called increase in the preload, more blood returns to the heart, and decrease in the afterload. Like when heart contracts, there is no tightness, relaxes. You have a wonderful sleep. It's not the how long you sleep. People say you need to sleep 6 hours, 8 hours. Yeah, even if it's six hours, look at that. 6 hours, your 25% is the REM sleep, rapid eye movement, and 75% is the non-REM sleep. So 75% will be your 4.5 hours. Out of 4.5 hours, the first 50% is stage 1 and stage 2, and stage 3 and stage 4 will be another 50%. So half of 4.5, little less than 2 hours, even 2 hours. So if you get 2 hours of deep sleep, that's enough sleep to cause all the repair in your body and mind. See, my even breathing, even my wife tells me when I'm sleeping, my exhalation is longer than inhalation. Once you finish, slowly straighten up your leg, put your other hand high up, and able to get up, sit down, and then put your hand, this is called a lotus mudra, Padma mudra, touch your little finger and your thumb, separate your ring finger, middle finger, and index finger. It connects your body, mind, and spirit. Bring it slowly close to your heart. A yoga therapy relaxation is a wellness, physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us all the healing. Put your hands in front of your heart chakra, and finish with another palming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, slowly and slowly, if you're wearing glasses, remove your glasses. Take the hands, put it over your eyes like a cup. Let the ice take all the heat from your hand. Then massage your forehead. Massage your eyes. Massage your face. Massage your ear, behind your ear, in the front ear lobe, in the back. Bring the hands in front. I cannot mess up because I have the part, but it's okay. You massage in front of your neck. It's called your carotid sinuses. Relaxation. Massage in the back. The insertion of the two muscles, trapezius and sternomastoid muscle. Wonderful relaxation practice. And this is the beginning. As I said, this is the whole day of a class. So next Saturday, I'm going to be out of town. So there will be no classes next Saturday. And for the students, you take a little bit of a stretch break and you come back again at 12 o'clock to continue your class. Thank you again. It's wonderful to be with you every Saturday and hopefully to see you in a couple of weeks.